3 a.m. wake ups, heavy day one that hijacks your calendar, mood swings that don't match your life, your pill or IUD keeps things quiet, but is it masking symptoms that are often termed menopause? Or are you one of the ones that hormonal contraception is helping you thrive? Today, we're getting honest about birth control at 40 plus, when it's smart, when to screen, and how to feel steady again. Welcome to the Feel Better, Feel Great podcast, episode 174, Masking or Helping, the truth about birth control at 40 plus. I'm Dr. Andrea McSwain, DO and Functional Medicine Clinician. For those of you doing well on birth control for hormonal support, I may still encourage you to listen to understand your options. If you're noticing heavy flow, cycle chaos, mid-sleep wake-ups, brain fog, or anxious irritability, and you're using or considering hormonal contraception to address symptoms, this is your roadmap. Also, if you're feeling stuck on birth control and don't know anything else, this is your go-to episode. If you're 40 plus, your hormones are shifting. Birth control can be a stabilizer and a bridge or a mismatch. So let's find what serves you. I want to talk about the term perimenopause. I'm going to tell you, I think it is a bucket diagnosis. I think people are just being dumped into that, but I'm going to use the phrase because a lot of people are using it. So in perimenopause, right, it's years of fluctuating estrogen, relatively lower progesterone, and more anovulatory cycles or cycles that don't include ovulation. It can cause estrogen swings of breast tenderness, sleep disruption, anxiety spikes, and heavy irregular bleeding. It can cause lower progesterone. So you have fewer ovulatory luteal phases, right? So that means your body's rhythm is getting a little bit in need of more support. And this can mean lighter sleep, irritability, and heavier, longer periods. Okay. Also, cycle variability is somewhat expected as people start to leave reproductive capability. But I want to remind you, menopause is 53. So if you're getting in the perimenopause bucket or you're having these symptoms and people saying, oh, it's perimenopause, and you're 44, 42, you need some more education for options. All right. So if you're having cycle variability, it means your rhythm is starting to come offset. And so while that can be somewhat expected, it's not supposed to be in your 40s. Contraception is often the tool given to you to smooth these swings, but it might be hiding helpful clues if you're actually doing the troubleshooting of your symptoms. And that's why I hope you stay connected to the rest of this episode, because I think when you get through it, you're going to remember these tools for the rest of your time in, this time of your life. Okay, so at 40 plus, if you are noticing sudden changes in bleeding patterns, this deserves attention. Okay, and we'll cover those red flags a little bit later. So with that baseline, let's talk about how birth control by conventional options can stabilize. Okay, but we don't want to miss those safety steps. So there are some ways, again, that birth control can be well matched. Okay, especially if the fact that you're likely still fertile, right? So you still need to recognize that. But if you are using it for birth control, that's one thing. But if you're using it for hormonal support, right, that would be another thing. But basically, birth control pills have been kind of by convention used to help people who have heavy flow and cramping in an effort to give them a more predictable bleeding pattern. It has also, birth control pills have also been helped for anemia, which is excess bleeding, so that it would reduce these mega bleeds, right? Also, birth control pills have been used for quality of life if someone's having painful, disruptive cycles. And some methods have been used to quiet vasomotor symptoms like hot flashes, and also sometimes to quiet mood symptoms like irritability, PMS, PMDD. Okay, so let's look at a few of these, and I have addressed these recently, but I just want to briefly go over those. So you have your progesterone-based IUDs, Mirena, Kylena, Skyla. These are often used as a top pick for heavy bleeding. Often far lighter bleeds, and sometimes amenorrhea or no period happens with these. Okay, so you stop bleeding um, because the progesterone affects the lining, right? And then you've got some combined methods. So that's the pill that goes through your mouth that bypasses or that goes through the liver. So you got to remember that. And that's going to affect your whole body. Then you've got the patch and NuvaRing, which are continuous combined methods, but they don't go through the liver to be processed. And that's a really big deal. You want to remember those differences. Now, this might stabilize mood and bleeding, and continuous use can reduce swings because it's basically kind of stopping, these ups and downs, kind of giving you more stability. And then you have progestin only options. So mini pill, injection, implant, and these are useful when estrogen is contraindicated. The bleeding patterns may vary. Some people may not bleed at all, which is amenorrhea. Some people might spot, and some people might spot enough that's very aggravating and becomes its own problem. So the right for now method is a win. It doesn't have to be forever if you're looking at some symptom abasement. Now, or also said a little differently, a Band-Aid. So if you're looking at a Band-Aid, then, some of these are Band-Aid-like solutions, right? Short term. But sometimes people are like, just do anything. Help me with anything. So I want to make sure you know those, because those are pretty readily accessible with your regular OB-GYN. Okay. And of course, you want to be aware of starting or continuing hormonal contraception, because some of these things can cause blood pressure changes. So you want blood pressure checks. You want to make sure you're talking to your doctor if you have a migraine history, especially with aura. You want to talk about your smoking status and your body mass index. What are your clotting risks or any family history there? If you have a diabetes diagnosis, and any personal or family history of breast or gynecologic cancers. Okay, and then also think about breast screening. And then if you have heavy or abnormal bleeding, consider getting those labs tested and a transvaginal ultrasound. Um, and then sometimes you'll also have a recommendation to get endometrial sampling. And really that sampling is looking for cancer or not. So that's sometimes a concern with heavy irregular bleeding. So if you're having it, your concerns are valid. And those are some red flags and some things to do about it. Now, other risks to know, right? Clot risk, as I said, blood pressure, and breast and cervical risk. And then obviously, anytime you feel these symptoms, you want to seek medical attention. So new or worsening depression or suicidal thoughts, really important to seek care. It matters, and you deserve to receive that care. Heavy bleeding that's soaking through protection heavily for greater than 2 hours, bleeding after sex, because that's screaming a cervical problem, or bleeding between cycles that persists. Okay, those are really important. And then obviously, if you have severe chest pain, shortness of breath, one leg is swollen and painful, but not the other. You have vision or neurologic changes, or new or worsening migraines with aura. Okay, because those are some big issues, and you really want to make sure that any medication you're using isn't exacerbating those, or is not contraindicated. So I'll put it like kind of like that. But once the safety gets squared away, we can start making smart symptoms based solutions. So I want to talk first about like what convention will say. So I say convention, but basically that's kind of how OB-GYNs were trained, right? What's the conventional training that we have, right? So if you come in for if you come in for crippling heavy flow and you have anemia risk, it's likely they're going to suggest the Mirena IUD. It is often considered first line, and that's because it's going to disrupt the lining. Now, some people will actually just gush that out, and they'll actually they'll lose the IUD. So that is a consideration that you want to be aware of. Also recognize still, if you had that much bleeding, you probably have an anemia risk, and you need to be considering plant-based liquid iron repletion. Okay, and of course, looking at labs. And then we want to track fatigue. So that's that one. Now, matching the method to the symptom, if you have cycle unpredictability and mood swings, convention will offer kind of the standard birth control pill, maybe the patch or the ring, but most of the time it's the pill because the pill is going to like lower the system, right? Just kind of like dampen the whole body. Um, you can say that nicer, smooths peaks and valleys, right? But you definitely want to review migraine, oral history, smoking, BMI, because if you're in your 40s plus and you get on conventional birth controls and you have those risk factors, that can be concerning. So I would say if you have cycle unpredictability and mood swings, we need to test. Okay, so that's important. We need to know what's going on. And then we might actually look at some ways to support your body with nutrition, supplementation, and even some education about bioidentical hormone replacement therapy. So, how can we actually kind of bolster your system in a way that helps it organize? Of course, if we're looking for the situation, if we're looking at a situation where estrogen is contraindicated, then by convention, you would receive only progesterone or a synthetic progestin, actually. This will cause a variability in bleeding. Again, I would recommend testing and understanding what the relationship is between estrogen and progesterone and some other higher hormones, and looking at how to facilitate the healing of the disruption. Now, some people get on birth control pills in their 40s because they have acne or their skin is flaring up. That has a lot to do with something I'll tell you in a second. But by convention, a combined method is usually recommended, and it's usually recommended on the pill. Now, hormones have a lot to do with your skin. There's no doubt about it. And you need to know that, particularly looking at how testosterone is or is not converting to estrogen. Okay, because that's important. And we do that with root cause testing for the hormones, right? Root cause hormone testing. And then, of course, you want to pair that with a very good skin strategy. And I have been dealing with this for people for many years. So I do a skincare consult because it really matters. And it's not to be taken lightly. So I do a skincare consult because I want people to know how to have improved skin and also that there is a relationship between skin and hormones. Okay. And then, of course, some people come to the conventional gynecologist and they're like, I have night sweats, insomnia. I mean, these are like really significant, frequent complaints, right? Or concerns that patients have. And by convention, birth control pill, antidepressants. There you go. You got 2 pills, take those. Now, the literature, tells you some different stories about how to address those and actually how part and parcel night sweats and insomnia are and to causing vasomotor symptoms. So there's some good literature there. There's a lot of plant-based estrogens that do really well in this situation. So again, by convention, birth control pill, antidepressant, I would recommend thinking and learning about how you want the testing, but you also might consider some really basic supplementation to really support those symptoms and some nutrition effects as well. There's some good ways to do that, right? And then of course, those symptoms are a little more trending towards menopausal symptoms for the most part, but there can be some other considerations as well. So if you start having vasomotor symptoms, we might be looking at some menopause hormone therapy and looking at those pathways because it's a little bit different than this idea of like perimenopause just so you know. Okay, so looking at foundational supports as well, I think that is a very important consideration always. Foundational supports are about your day in and day out, what's happening, right? So food plays a big role in that. Your protein, you're looking like 75 to 150 grams a day. Fiber, 30 grams a day, approximately. These are really going to support estrogen metabolism. I love to think about how minerals and vitamins can support our body, that supplementation that's really chemistry oriented, right, to how we work. So that's optimal magnesium in the evening to help us sleep better, help our muscles calm down. B complex just makes everything work better. It's such a critical way to bring all the B vitamins together. Omega 3s do a great job at really helping the body reduce inflammation and getting the support it needs, and it's great for skin. It's critical for skin. And then, of course, plant-based liquid iron, if low ferritin, and that's a lab test that you want to get. So we know sleep is foundational, right? So consistent waking time is really important. It really is important. And then receiving light in the morning, right? Looking out to the sky. I'm looking out at the window right now. Anyway, and then glucose steadiness, that's very important. Blood sugar stability helps our adrenals, and that helps our ovaries work better. So there's some other labs too that help refine this information. And again, how your thyroid's doing, vitamin D, critical for hormones, right? B12, folate. And then we look at blood sugar stabilization and that's A1C, fasting insulin. Of course, you want to know your lipids, right? Your CMP, and then there's other tests that we often have, but they might not have been interpreted very well. And so that really means a lot to me too. You know, those are really important things to understand. Now, now you might not be thinking about it today if you're on birth control, but at some point you will be, right? And at 40 plus, irregularity may reflect more of some of the symptom things that are going on that are based on rhythm disruption. Okay, so that irregularity is not normal physiology. And that's really important to consider. As you are getting off the pill, it's not post pill syndrome. It might actually be symptoms related to hormone rhythm dysregulation. But remember, if you are getting off the pill or you're getting off birth control and you're like, okay, I don't need it for birth control. I've been given it as a hormone pill. Let's switch that up, right? That's a really important consideration. But if you are using it for birth control, then you definitely want to be consistent with maintaining your birth control plan, right? The other thing is we want to make sure that we get your nutrition on board, we get your sleep, and all these things to help you be stabilized. And then, of course, we love tracking biofeedback and your rhythms and your metrics with that. So, again, what's your bleeding pattern? What's your energy, your mood, your night sweats? How's your skin doing? Right? And then obviously you need to escalate care if you're having heavy or irregular bleeding or persistent insomnia and mood changes. Like you deserve to get that care. That's really, I just want you to know that you deserve to be taken care of. And everything you say should be believed. Everything about your health should be believed. Right? You have a PhD in you. I like to say that. So I just want to say, you know, guys are wrapping up and thinking about 40 plus, right? Don't get stuck in this bucket of perimenopause, right? Perimenopause is more reflective of symptoms that are aggravating your systems. They're aggravating your fundamental rhythms for your hormones, okay? It's not exactly a diagnosis, or I like to say it's a bucket diagnosis. Like people just hand it out. You know, they kind of diagnose an adios, oh, perimenopause. And you're like, okay, well, what do I do about that? And like, well, that's what you have. It's like, that's not an action item, right? You need action items. You need recommendations and you need education and you need options and If you're working with a clinician, they need to give you recommendations. But first it's education and then it's options. So for some of you who've listened to this, you're like, birth control, it's my stabilizer, it's my bridge for now. I'm good. I've learned about what to do. I've learned about maybe some other options, but I'm good with it right now. But if it's not the right tool for you, or dare I say it's the wrong tool, then you deserve, again, this education and the options. You deserve predictable days, steady energy, solid sleep, powerful muscles, right? You deserve to be connected to the rhythms of your body. So I just want to thank you so much. If you are being helped by this, please share it with a friend who's navigating 40 plus hormones. Um, Please bring your questions to your clinician. Now that I hope you've really received a lot of education and options, now you can really go into and talk with your clinician, whether it's conventional or whether you're looking for a functional doctor who's looking more for root cause things. Still, this will be a good guide, right? And you can use this episode as your agenda to ask better questions, hopefully. That's what I hope. Again, subscribe to this channel, share with others. We'll be sending out to look for some guides. And if you'd like to kind of find out more about us, go to drmcswain.com or click on those QR codes that you saw throughout the episode so that we can get things going. All right. Thank you so much and blessing.